The recent outbreak of dengue fever, also known as knokkelkoorts, in Brazil and other parts of South America has revealed an alarming public health issue. With an increase of nearly 5 times the number of confirmed cases compared to last year, authorities have had to take various measures to combat the spread of the disease. Dengue fever is transmitted by the Aedes aegypti mosquito, which thrives in warm and humid environments. The combination of heavy rainfall and high temperatures has caused the population of this mosquito to flourish, significantly increasing the risk of infection. The symptoms of dengue fever are severe, ranging from high fever and headache to severe muscle and joint pain, and in some cases even life-threatening bleeding. The Ministry of Health of Brazil has declared a state of emergency in 6 states and the Federal District of Brasilia due to the outbreak of dengue fever. This has led to large-scale efforts to eradicate mosquito breeding sites and launch vaccination campaigns to combat the spread of the disease. Not only Brazil is affected by this health problem. Other countries in South America, including Peru and Argentina, are also experiencing an increase in the number of cases of dengue fever. Even the Caribbean region is not immune to this trend, with Curaçao experiencing a significant increase in dengue cases over the past month and a half. The increasing number of infections not only affects the local population but also tourists visiting the affected areas. For example, the tourism sector in Curaçao is faced with the challenge of informing guests about the risks of dengue fever and how to protect themselves during their stay. Epidemiologists and health authorities emphasize the importance of preventive measures, such as wearing protective clothing and using insect repellents, to reduce the risk of mosquito bites. These precautions can help reduce the risk of infection and limit the spread of dengue fever. For those who still become infected with dengue fever, the disease can take a severe toll. Jacqueline Steekstra, a dengue patient who was staying in Curaçao, described her experience as one of the sickest moments of her life. She highlighted the severe symptoms of the disease, including high fever and intense muscle and joint pain. Controlling the outbreak of dengue fever requires a coordinated effort from health authorities, local communities, and individuals. By taking preventive measures, eradicating mosquito breeding sites, and promoting awareness of the disease, we can together curb the spread of dengue fever and protect the health and safety of communities worldwide. The Ministry of Health in Brazil and other affected countries has been actively responding to the outbreak of dengue fever by implementing various public health measures. These measures include surveillance and monitoring of mosquito populations, as well as educational campaigns to raise awareness about the symptoms of dengue fever and the importance of preventive measures. Additionally, efforts have been made to improve access to healthcare services for those affected by dengue fever, including the provision of medical treatment and support for patients. This includes the establishment of dengue treatment centers and the distribution of medical supplies and resources to healthcare facilities in affected areas. Furthermore, vector control measures have been implemented to reduce the mosquito population and prevent the spread of dengue fever. These measures may include the use of insecticides, larvicides, and mosquito traps to target mosquito breeding sites and reduce mosquito populations. Overall, the government response to the outbreak of dengue fever has been multifaceted, involving a combination of surveillance, education, healthcare provision, and vector control measures to mitigate the impact of the disease on affected communities. In addition to national efforts, regional cooperation and international assistance have played a crucial role in addressing the outbreak of dengue fever in South America and the Caribbean. Countries in the region have collaborated on various initiatives, including sharing information and resources, coordinating response efforts, and providing assistance to affected communities. International organizations, such as the World Health Organization, WHO, and the Pan American Health Organization and PAHO, have also been actively involved in supporting countries affected by the outbreak of dengue fever. This includes providing technical assistance, mobilizing resources, and facilitating coordination among stakeholders to strengthen the response to the disease. Furthermore, bilateral and multilateral partnerships have been formed to support countries in their efforts to control the spread of dengue fever and improve healthcare infrastructure. This includes collaborations between governments, non-governmental organizations, academic institutions, and private sector partners to address the underlying factors contributing to the outbreak of the disease. Overall, regional cooperation and international assistance have been instrumental in enhancing the capacity of countries to respond to the outbreak of dengue fever and mitigate its impact on public health and well-being. The outbreak of dengue fever has had significant socioeconomic impacts on affected communities, including loss of productivity, increased healthcare costs, and strain on healthcare systems. This is particularly true in areas with limited access to healthcare services and resources, where the burden of dengue fever may be disproportionately borne by vulnerable populations. Furthermore, the outbreak of dengue fever has highlighted the importance of community resilience and engagement in responding to public health emergencies. Communities have played a critical role in supporting response efforts, including participating in vector control activities, raising awareness about the disease, and providing support to affected individuals and families. In addition, the outbreak of dengue fever has underscored the need for long-term, sustainable solutions to address the underlying factors contributing to the spread of the disease. This includes addressing environmental factors, such as urbanization and climate change, as well as social and economic determinants of health, such as poverty and inequality. Overall, the outbreak of dengue fever has highlighted the interconnectedness of health, environment, and socioeconomic factors, and the importance of holistic, community-driven approaches to addressing public health challenges. Research and innovation have played a crucial role in advancing our understanding of dengue fever and developing new approaches to its prevention and control. This includes research on the biology and behavior of the Aedes aegypti mosquito, the development of new diagnostic tools and treatments for dengue fever, and the evaluation of novel vector control strategies. One area of research that has shown promise in dengue control is the development of genetically modified mosquitoes that are resistant to dengue virus infection. These mosquitoes could be released into the wild to compete with and suppress the population of wild mosquitoes, reducing the risk of dengue transmission. One area of research that has shown promise in dengue control is the development of genetically modified mosquitoes that are resistant to dengue virus infection. These mosquitoes could be released into the wild to compete with and suppress the population of wild mosquitoes, reducing the risk of dengue transmission. In addition, research is ongoing to develop new vaccines and antiviral therapies for dengue fever, with several candidates currently in various stages of clinical development. These include live attenuated vaccines, subunit vaccines, and monoclonal antibodies targeting different components of the dengue virus. Furthermore, innovative approaches to vector control, such as the use of Wolbachia bacteria to reduce mosquito populations, are being evaluated for their effectiveness in preventing the transmission of dengue fever. These approaches could complement existing vector control measures and help reduce the burden of dengue fever in affected communities. Overall, research and innovation play a critical role in advancing our ability to prevent, diagnose, and treat dengue fever, and hold the potential to transform our approach to dengue control in the future. The outbreak of dengue fever in Brazil, South America, and the Caribbean highlights the ongoing threat posed by vector-borne diseases and the need for sustained efforts to prevent and control their spread. While progress has been made in recent years in reducing the burden of dengue fever, the recent surge in cases underscores the importance of remaining vigilant and proactive in addressing this public health challenge. Moving forward, a comprehensive, multi-sectoral approach is needed to address the underlying factors contributing to the spread of dengue fever, including environmental, social, and economic determinants of health. This includes investing in vector control measures, strengthening healthcare systems, and promoting community engagement and resilience. Furthermore, continued research and innovation are essential to developing new tools and strategies for dengue control, including vaccines, antiviral therapies, and novel vector control approaches. By harnessing the latest advances in science and technology, we can enhance our ability to prevent, diagnose, and treat dengue fever, and ultimately reduce its impact on public health and well-being. In conclusion, the outbreak of dengue fever serves as a stark reminder of the importance of global cooperation, innovation, and resilience in addressing public health challenges. By working together and leveraging our collective expertise and resources, we can overcome the threat posed by dengue fever and build healthier, more resilient communities for the future. Thank you for watching. If you found this video informative, don't forget to like, share, and subscribe for more updates on this channel. Together, we can raise awareness and make a difference. Stay safe and healthy.